Does acupuncture help headaches and migraines? In this video we're going to answer the question, does acupuncture help headaches and migraines? We're going to look at the research on this subject and come to a conclusion. We're also going to give you the acupuncture points that they used in these studies for the various conditions. Now, headaches are usually harmless and they're not normally caused by anything severe, but in rare cases they can be. Infections, tumours, bleeding and arteritis. So once these conditions are ruled out, headaches can be categorised in 4 ways: cluster headache, tension type headache, migraine and medication overuse headache. Firstly, a cluster headache. A cluster headache is an excruciating attack of pain in one side of the head and eye. There is minimal evidence for using acupuncture on cluster headaches, but this study by Fofi et al. 2014 found that acupuncture did find short-term relief in cluster headaches. Next, a tension type headache. This is the most common type of headache and feels like a constant ache that often affects both sides of the head. It is also common to feel neck muscle tension and pressure behind the eyes. As you would expect from the most common type of headache, there is lots of research into this, and overall it appears that acupuncture does help. In a study by Lind et al. 2016, they found that acupuncture was effective for treating frequent episodic or chronic tension type headaches. Another study found that 10 sessions of acupuncture over 5 to 8 weeks was best for the prophylactic treatment of chronic tension type headaches, according to Carville et al. 2012. Santesso et al. 2017 looked at 7 studies with a total of 795 people, and they concluded that, in general, people who have frequent tension type headaches will probably have slightly fewer headaches at 3 to 4 months after beginning the course of acupuncture. Specifically, people will probably have fewer headache days per month and probably more will have half as many headaches. Next, a migraine. A migraine is usually a moderate or severe headache felt as a throbbing pain on one side of the head. It can also have symptoms such as nausea, vomiting and increased sensitivity to light or sound. There are several types of migraine, including a migraine with an aura, where there is a specific warning sign just before the migraine begins, such as seeing flashing lights or visual disturbance. There's a migraine without aura, the most common type, where the migraine occurs without specific warning signs. And then there's a migraine aura without headache, also known as a silent migraine, where an aura and other migraine symptoms are experienced but no headache. So as with tension headaches, there too is plenty of research into acupuncture for migraines, and once again the evidence is positive. This Cochrane review found that adding acupuncture to symptomatic treatment of migraine attacks reduces the frequency of headaches, according to Lind et al. 2016. Lee et al. 2009 found that acupuncture is clearly effective in relieving pain and preventing migraine relapse or aggravation. Also, this study concluded that current clinical evidence suggests that Verum acupuncture is superior to sham acupuncture in migraine, according to Yang et al. 2016. Next, a medication overuse headache. These headaches are frequent or daily headaches that develop after taking painkillers for tension headaches or migraines over a long period of time. Treatment is basically withdrawal of the overused drugs, pharmacological and non-pharmacological support and prevention of relapse. So in this case, acupuncture isn't really used to cure this type of headache, but can be used to help to prevent it. Basically, acupuncture can be used to manage the headache that the drugs were used for in the first place. Kristoffersen and Lundqvist, 2014. So what are the best acupuncture points to use? In a review by Fofi et al. 2014, they found studies typically had 6 sessions given at least once per week, and most studies left the needles in place for 20 to 30 minutes. Here are examples of the common points for acupuncture in this type of headache. In a Cochrane review by Lind et al. 2016, they found that it was typical to have 6 treatment sessions given at least once per week. Here is an example of common points for acupuncture in this type of headache. In a Cochrane review by Lind et al. 2016, they found that the number of treatment sessions in studies reviewed was between 6 and 12 in 13 trials and 16 or more in 9 trials. Most studies left the needles in place for 20 to 30 minutes. Here are some common points used for migraines. For the references in this study, check out the description box below. We want to keep making great content for our subscribers, so if anyone would like to support the channel by making a pledge, then we would be extremely grateful, and you can do this on our Patreon page here.